And they kill people the same way insecticides kill bugs, because they're the same class of compounds. Nerve agents kill people the same way insecticides kill insects and fleas, and because they act exactly the same way and they affect the same neurotransmitter, and they cause overstimulation of the nervous system in people just like they do in insects. The way they act on the body is that they basically kill this enzyme that normally stops this neurotransmitter from signaling. Okay, and that's how they all work. By causing excessive stimulation in the brain, people wind up having convulsions and seizures. The reason people die quickly is because it actually interferes with their ability to breathe. And it does that in part by acting in the brain, and in part by acting at on the nerves that normally tell your respiratory muscles to allow you to breathe. So you wind up having a ton of secretions in your airways and in your saliva glands, and people wind up almost drowning in their secretions, and that combined with the inability to breathe are some of the immediate toxic effects. With some of the nerve agents, the effects can be reversed hours after exposure. But with some of the nerve agents, there's only a window of a few minutes before the actions can no longer be reversed. There are two drugs that are given after exposure. The Army actually had injector system that would inject both simultaneously. One drug acts to reverse the excessive stimulation of by this neurotransmitter, and the second drug acts to reverse the action of the nerve agent itself. The classical nerve agents are liquids, and they can be dispersed either as vapors or as aerosols. Apparently, this agent that was used in England is actually a powder, and the risks to medical personnel are basically the same risks that would be to anyone exposed to them. That they can cause, loss of breathing. At high enough doses, they could cause seizures, and so they could be, as lethal to a medical person responder as to the actual target.